as larger centers such as Regina deal with overflowing acute care beds in local hospitals. The Cypress Health region is indicating a positive flow of patients throughout the healthcare system. Cypress Health Region CEO Beth Vachon states at this point in 2012, patients are getting the care they require in a timely manner, from the emergency room, surgery, to acute care.
We're doing okay. I mean, we're always busy in our hospital, but we aren't at the point where we have been in the past, where we're looking after people in the emergency room who should actually be admitted, and we've certainly been there. You know, and it's interesting because one of the strategies that we're looking at is something called the D system. And what the D system does is actually it's a better communication between the tertiary hospitals in Regina and Saskatoon and back to the regional hospitals. And is there a way that regional hospitals can be supporting the tertiary centers better to actually flow patients back through to a different level of care to free up beds when those higher acuity patients who require tertiary care are needing them. So that's when we talk about thinking and acting as one system and removing barriers to patient flow so that people are getting the right care where they need it. Those are the kinds of things that we want to work on as a provincial health system, because every region has a part to play in the backlog in ER in Regina and Saskatoon.
Vachon indicates this new enhanced system could be extended to assist patients from outside of their region.
Might be an option where we could certainly be able to provide care for people who may not need tertiary. That's, I think, certainly something that we need to discuss. But we do know we've got patients that are in Regina and Saskatoon who have received the kind of care that they need and may just be convalescing in Regina. Those are people we can bring home and finish their convalescence at our regional or in some of our community hospitals. So those are the kinds of strategies that I think are really going to start to change the system by looking at our discharge systems and how we transport patients back to appropriate levels of care.
The Cypress Health region employs close to 1,650 staff members and provides healthcare services for approximately 44,000 individuals across southwest Saskatchewan.